Ladies and gentlemen, thank you for standing by. Welcome to the Pension Fund Q&A conference call. At this time, all participants are in listen-only mode. Momentarily, we will conduct the question and answer session. Instructions will be given at that time. If you should require assistance during the call, please press star then 0. This conference is being recorded, and at this time, I'd like to turn it over to James Hamlet. Please go ahead.
Thank you, operator. Hello, everyone. Thank you for joining us today for this call-in session devoted to church-wide health care. For the next hour, I will be your host for this question and answer session. With me today is the Reverend Dr. Todd A. Adams, who is President-elect and Vice President. We have 11 other staff joining us who may be able to answer questions if they are appropriate for them. This session is scheduled to be an hour long. It is being recorded and will be posted on our website next week. If we run out of time and your question is not answered, you may want to join us for the next session, which will begin this evening at 7 o'clock Eastern Standard Time. You may want to check our website for the telephone number and access code. If you're not able to ask your question or have questions specific to your situation, you can email us at pfcc1@pensionfund.org. Please keep in mind this is a public forum, and as such, it is important that you do not ask questions specific to your particular accounts. We do not want to reference anything that would violate your personal privacy for your accounts or your situation. This is especially important since we are discussing health care. We will open up for questions in just a moment, but I do have a few comments. I'm sure you're on the phone and have seen the news release of June 17 announcing the Pension Fund Directors acting as trustee of Christian Church Healthcare Benefit Trust made the difficult decision to discontinue offering health care plans for persons under age 65 effective December 31, 2016. This decision affects all participants under age 65, including pension fund employees. Participants over age 65 with other Medicare eligible or others who are Medicare eligible will continue to have access to the 2 Medicare supplement plans through church-wide health care. Christian Church Healthcare Benefit Trust has fulfilled many of the goals that were set forth when it was established, and healthcare was established by General Assembly resolution at the 1971 Louisville Assembly. Principal among those goals were access to health care without pre-existing condition and portability across state lines. Today, those needs can be met outside church-wide health care more cost-effectively and properly tailored to meet individual needs. Going forward in 2017, employers with 2 or more employees will have 2 options. They may find or establish a new group plan for their full-time employees or discontinue offering health care as a tax-free employee benefit. If an employer elects to discontinue health care insurance as an employee benefit, Pension Fund encourages the employer provide a benefit bonus as a taxable benefit to offset part or all of the taxable health care. The bonus would be taxable income, but not tied directly to the cost of insurance. It is against the law for the employer to pay premiums directly to an insurance company. Employers with only 1 paid employee, however, may continue to reimburse or pay premiums for their employee on a pre-tax basis. Pension Fund will be following its own advice and discontinue offering health care as a tax-free benefit. We will also be providing a benefits bonus to each employee so that they might pay their insurance more effectively. Finally, we will be engaging an online service provider by the name of Gravy to assist employees with their search and selection of health care coverage, either through an exchange or as private coverage. We will be encouraging other employers to use Gravy if they choose to go through the individual coverage plan. I'm sure you have a number of questions, so we'll stop here and open up for questions. So, operator, cue them up, please.
Ladies and gentlemen, if you wish to ask a question, please press star then 1 on your touch-tone phone. A voice prompt on your phone line will indicate when your line has been opened. Again, that is star 1 for questions, star 1. We will pause momentarily. Again, that is star 1 on your touch-tone phone to ask a question. We will take our first.
This is Bruce Dobbins.
Hi, Bruce.
It just sounds a little contradictory to me how you said that, and Beth heard one thing as regional minister, and then the site says something else. So what is, you say illegal for pre-tax dollars to pay for it, yet if there is one employee, the employer can pay premiums with pre-tax dollars. So it's sort of, to me, which way is it, or how do you clarify those two different ways of looking at it?
Okay. If you have 2 or more employees, then the IRS takes the position that you cannot, the employer cannot pay the insurance directly. If they have 1 employee, they have allowed that.
Gotcha. So it's 2 or more, no, 1 only, yes. Gotcha. Okay, thank you.
Oh, you're welcome.
We'll take our next question.
Hi, this is Sandy Messick. So as regional minister, I had the same kind of question as Bruce. I just need to clarify a little more. When you say 1 employee, does that mean 1 employee that's offered health insurance? In other words, a full-time employee, but they also may have a very part-time music minister or custodian, or is it if they have more than 1 employee, regardless of whether that position would qualify for health insurance, that falls under the 2 or more?
Right. We are referring to 2 or more full-time employees. Part-time employees are not considered.
Okay, that's helpful. So 2 or more full-time. And then the other question is, if they have 1 employee, 1 full-time employee, and the church then could pay the premium pre-tax, is that true also if they go through the exchange, or is that only if they find the coverage some other way?
They cannot go through the exchange in that way. Gene, you had a clarification.
Just want to make sure that as we understood part-time, it was 25 hours or less. That is the key to part-time. And also keep in mind that this is a moving target, and so there's information that the employers should stay up to date on, at least on an annual basis, to make sure that they are in compliance.
All right. Thank you.
We'll move to our next.
This is Tom Plumley. My question was about the taxability issue as well, and I'm still not clear on it. We have multiple full-time employees, but only 1 full-time employee who is currently on church-wide health care. Does that mean that 1 full-time employee can have his premiums paid, or since we have other full-time employees, does that make that illegal?
My understanding, Tom, is that it refers to full-time employees without regard to how the insurance is being constructed. You may have other full-time employees that have health care, perhaps through their spouse's coverage, or they may have other private coverage.
Right.
As an employer, you have multiple full-time employees. Therefore, it would not be able to pay any of them directly.
Okay. Thank you. So it will be taxable income anyway.
That's correct. Todd, you wanted to...
Yeah, Tom, it's also important to note that in 2013, the law changed, and you were no longer able to directly reimburse employees without it being taxable compensation. Right. So if you have employees who are being paid to not be in church-wide health care, and they were being paid under a pre-tax arrangement, that changed, and that has been taxable income to them for the last couple of years and needs to be corrected going forward. So if, for example, if I were on your staff and I went on my spouse's health care coverage and the church agrees to pay me a reimbursement, prior to 2013 that was pre-tax, post-2013 that became taxable income.
Yes, we've understood that. Thank you.
Okay.
And we'll take our next question.
Yes, this is Marty Williams from California. I was wondering what work conversations have taken place regarding the possibility of having those interested in our group enter into to be a part of the United Church of Christ insurance plan or other group plans. I'm concerned because going out on the open market in California, what I'm looking at is limited choices, selections with companies that have a reputation of large increases and very poor customer service. There are certain benefits to being involved in a group that really can't be measured by dollars. Being an individual, certainly you might save a little bit on premium, but there's a lot of evaluations of that. But I'm wondering about what conversations have taken place or not taken place with the possibility of other being a part of another denomination's plan.
Well, Marty, we've had conversations with the UCC plan. We've had conversations with the United Presbyterian plan in particular. Our group, the demographics of our group generally was not attractive to them as a group. I would think that if you as an individual pastor wanted to make contact with the UCCs, they would make a determination whether you could participate. We could not make that. We have not entered into any kind of agreement in that regard.
Marty, you would be somebody who would be a good candidate as well to look at the Gravy service because they offer more than just the ACA plans as well. They do offer what would be termed private plans or plans that would be sold through brokers that are beyond the exchange market.
And the information will be sent out about making contact with this group. I can't really, the sound quality is such that I can't really tell what you're calling it.
Yes, Gravy, Gravie, and we'll be putting out additional information on the website. We're finalizing that agreement with them, and they will be hosting some informational webinars on how to utilize their service, what all is included in their fee, and which not only is online access but also includes call center access to assist you in selecting plans based on medications, doctors, both private plans and ACA plans. For example, in Indiana, they start with about 120 plans, and through their questionnaire, it narrows it down to what you're looking for in terms of deductible, benefit, pharmaceutical, and then doctor availability, hospital availability, and helps you to narrow all of those down.
That sounds like it would be helpful given that as I've done my research, none of my doctors are on any of the plans available to me.
Yeah, and that's where the private insurance market, that Gravy taps into that the marketplace exchange does not, will be helpful to you. And that's part of the reason why we've been out researching a service like that.
Thank you.
And we'll move to our next.
Mike Valentine, Bell Fountain, Ohio. 2 questions. One, how does this affect our dental coverage? And if dental is going to be eliminated as well, what would be our options for that? And then question number 2, considering the board's decision in regards to discontinuing active, how viable will us retirees be with the supplemental?
I'll answer the second question, and then I'll look to Gene Fisher to answer the question about dental. As we've worked with our actuaries, the active plan has been, I'll say hemorrhaging. That's a medical term, but right. It has been claims have been in excess of premiums received. For the retiree plan, because of Medicare, the claims are a bit more predictable, and those are running at in effect a small surplus of premium over experience. So we feel fairly confident that we can continue that program for years to come.
Well, that's reassuring. Thank you. And as for the dental?
You want to speak to RX centers?
Yeah, The other thing, Mike, is that we are about ready to launch a new program, particularly with respect to retirees. For those people who have what I would call the highest price pharmaceutical coverage, and I'll give you an example. We have one retiree who has one medication that is running about $100,000 a year. Mm-hmm. There is a new program that we are going to be engaging in that will allow them to have an advocate with their pharmaceutical company and or foundations and such to see if we can get those funded in another way so that it doesn't hit healthcare insurance and saves both the plan and the individual thousands of dollars of money. So that new program, I think, will simply make it more likely that the program will continue for years to come.
Okay.
Mike, to answer your question about dental, currently we are utilizing Delta Dental,
yes,
and essentially as a pass-through. And so one of the things that we are confident is that members can find state plans individually. In addition, there are some ACA plans that also includes dental coverage. So those are the options that you'll have in the absence of us providing dental as a group plan.
Okay. Would you be sending out information in regards to that so we can access that?
Yes, we can send it out. Probably the best location to look for that will be on our website, and we'll be updating information to the website probably for the next few weeks on a weekly basis.
Okay, very good. Thank you.
And we'll move to our next questioner.
Yes, this is Anita Clarkson from Sugar Land, Texas. And I understand that, or I've heard that employers of a certain size are charged a penalty by the IRS when they don't provide adequate health care coverage and instead the employees have to go to the marketplace. Is that true, and what's the size of that employer?
That is correct, and it is a number. It is 50 full-time employees.
50 full-time equivalents. So under that, it would be okay.
That's correct.
I mean, no penalty is what I meant.
There is no penalty if the employer chooses not to offer health care as a benefit.
Is there any timeline, and is that changing to smaller employees in the near that we've heard about, or is it kind of at 50?
I'm not aware of any plans to reduce it. If anything, I would be inclined to think that the government would be wanting to increase that to make it easier, or to reduce the fine to make it easier for employers to make those decisions.
Okay, thank you.
We'll move to our next.
Yeah, this is Ray Miles, and the question I was going to ask has been asked already.
Okay.
Callers, if you find your question has been answered, you may remove yourself from the queue by pressing *2, and we'll move to our next.
Hey, Jim, Georgia Meese in Lexington, Kentucky, and I've already gotten my answer from the gentleman from Bell Fountain.
Great.
Okay, thank you.
Thank you.
Again, that is *1 for questions. We'll go to our next.
Yeah, this is Jack Strauss in Dallas. Mine is similar to that last one, is that we have over 50 eligible employees. Are you guys, or is Gallagher going to be doing something to reach out to the larger employees to look at alternatives?
We will be communicating with all of our larger employers to try to assist
employers.
them.
Sorry, yeah.
Yeah.
Okay, so you will be, or Gallagher will be, and is that going to be in the next week or two, or?
I would anticipate anticipate that Gallagher will be in touch with you within the next couple of weeks.
Okay, thanks.
Okay, you're welcome.
We'll take our next.
Hi, this is Charlotte Hoppy in New Mexico. I have a question for the group of us that have not retired yet but will approach retirement in the coming years. Will church-wide health care be an option to become a Medicare supplement for us, or not?
Yes, you will certainly be eligible. Anybody who turns 65 this year, next year, or in the future would be eligible as long as the program is there.
All right, thank you.
Again, that is star 1 to ask a question. Star 1. We'll take our next.
Yes, this is David Dubovich in Kansas. Question that was mentioned earlier about the Delta Dental as part of the church-wide health care. The question that I have is regarding the vision portion of that with VSP. Is that a larger company that will be able to help those of us as we're looking for health insurance?
Well, the VSP is incorporated in the health insurance program itself. It is a separate company, but it is in part of the health care benefits. So as that is reduced or eliminated, that will not be available. But I'm told that in most individual coverages, there is some kind of vision coverage.
Okay, thank you.
David, when you go out to the exchange and you look, you'll notice that it will say Blue Cross Blue Shield Silver 1000 with vision care. And so just make sure when you review the benefit summary that adult vision care is included, which is listed separately from children under the age of 19, which are included in all ACA plans. But make sure it has an adult option on it.
Okay, thank you.
Again, that is star 1 to ask a question. Star 1. We will pause momentarily. Again, that's star 1 for questions. We'll take our next.
Yes, this is Scott Brazell from Texas. The question that I have is, just a few minutes ago, you'd mentioned that if there's one employee that the church can pay the premium as pre-tax dollars, but that has to go directly to the health care provider, not through the exchange. Is that correct?
That is correct.
And when you're talking about the exchange, you're talking about the marketplace, healthcare.gov.
Yeah, I want to be more specific. If you are covered by what would be called an individual private health insurance through a local broker, the congregation could pay that. If you're going through the marketplace, whether there is a subsidy or not, you would not be eligible to have the church pay it directly.
Okay, and then the Gravy service assistance there will help share some of the additional brokers that might provide health care instead of having to go through the exchange. Is that correct?
They actually function as a broker.
Okay.
And gives you access to both the exchange and private insurance.
Okay, thank you.
Again, that's star 1 to ask a question. We'll move to our next.
This is Rachel Moore from Illinois. Can you tell me what this means for part-time employees, how that works?
Are you currently... That would be an employer decision whether or not they offer you the benefit. So for health care, the definition of part-time is 25 hours per week or less.
Uh-huh.
That is different than the standard Department of Labor definition at 29 hours. So that is an employer question as to whether or not they offer a benefit to their part-time employees. But whether you're part-time or full-time has no bearing on your ability to purchase health insurance through the marketplace, or whether or not the income is taxable to you if you're provided a benefit stipend to do so.
Okay, can you tell me the rules, regulations for full-time ministers? Is that the same as a part-time minister?
In terms of the taxability of the income, yes.
Yeah.
The one difference for clergy when they go to the marketplace versus lay employees is that you're reporting your adjusted gross income, and so housing allowance is not included in the income factor when determining income for the marketplace, which will allow many of our ministers to qualify for the tax credits or the tax subsidies through healthcare.gov.
Okay, thank you.
We'll move to our next.
This is Will Jewsbury in Kokomo, Indiana. Question about the advisability of whether or not to go ahead and have the employer, we have 3 full-time employees, establish a small group plan as compared to not. I noticed you said pension fund will not. Is there any way to speak to whether one is more advisable than the other?
Well, this is Todd. I would say that when you only have 3 employees in a group plan, and this is part of the reason for the creation of ACA, when you only have 3 employees in a group plan, the assumption is that somebody has a significant pre-existing condition, and the cost factor is pretty significant for trying to create a group that is that small. You could talk to a local insurance agent to see what they could offer. The savings will be pretty significant for you here in the state of Indiana. So you're looking at a premium savings between 30 and 50% by paying the taxable dollars to your employees and turning them out to the marketplace.
Okay. That's what I needed to hear. Thank you.
And we have no further questions in queue at this time. But as a reminder, it is star 1 to ask a question, star 1. We'll move to our next.
Hi, my name's Donna Froge. I live in Houston, Texas, and doing some research for Texas, the health exchanges in Texas. When you go into the individual side, most of what is offered are HMO plans and EPO plans. There was I think 1 PPO plan available to our family. When you go in through the shop marketplace, there's a lot more available. Is this broker that you'll be offering, is that something the church would be able to go through the shop marketplace through, or does our church have to do that for their employees?
The employer would contract with this firm, the Gravy, but you as the buyer of the insurance would go directly with them and through them to give them background information, demographic information, and then they would research on your individual behalf. So if you have multiple employees, each employee will be using Gravy separately, with the employer simply providing some form of financial assistance.
I do know that there's a regulation, unless you do it during open enrollment, that like 75% of the employees have to participate in order to go through the shop marketplace. Is this something that would be eliminated by us going through this broker? If you are in a group plan, if the group plan is terminated, then you do not have to wait for the open enrollment. You could move forward more quickly. What we are encouraging folks to do is to get prepared for the open enrollment period in November, December, for effective date January 1. So we're working with a time frame to help people prepare. But as a group, you could, if you were to terminate your insurance as a group, you could move forward more quickly. Okay. I guess the question was more about the 75% requirement.
No, there's no requirement.
There is not. Okay.
If you are eliminating the group, each individual person is on their own, and so there's no basis for 75% requirement.
Okay. Thank you.
We'll take our next question.
Hello. This is Roger Heimer. This is a retiree question, but I admit, but I thought I was saving about $1,000 on hearing aids through True Hearing. Will True Hearing continue to be available to us for further discounts or replacements and the retirement plan, or was it tied to something bigger than that? Second question is, what's the status of the Health Care Benefit Trust? Has it been drawn down somewhat, or will it continue to be strengthening the retiree plan?
Well, it has been drawn down significantly by the active plan, Roger.
Yeah.
And the discontinuation of that will allow us to hopefully replenish those reserves. And so we expect that to occur. I'm not familiar with True Hearing. I presume that's a Medicare benefit.
I don't know. It seems to me it was available as a full page in one of your publications, and we went to the same people who were going to charge us a certain amount, and it was discounted when we said we had True Hearing through pension plan by $1,000 to $1,500, and continuing to be available for batteries, etc., and replacement.
Okay.
Yeah, it's not used very much, but similar to VSP, it's a discount program.
Right.
But that program will go away as well, Roger, because I believe it's tied. Are you in the Medicare or the active plan?
Medicare.
Okay. Well, then it will continue.
It will continue. Okay. I wanted to be sure. We got two people who would potentially be shopping, and I wanted to know if we had to use it before the 1st of January, and it will continue past then.
Right. We do not anticipate any changes to any of our Medicare plans at the present time.
Appreciate that. Thank you.
We'll move to our next.
Hi, my name is Alicia Harker. I am actually, my family are members of the Pension Fund Healthcare, Churchwide Healthcare, but I'm eligible through another employer for healthcare as well. Open enrollment for them is July the 15th through the 31st. How does that work, since our coverage doesn't end with you all until December the 31st, but we have to make alternate plans? Are we able to opt out because of this decision and into my employer's and my other employer's plan?
Well, if you're moving into a different employer's plan, you can cancel your plan with us and move into that plan during their open enrollment. You should also check with your HR person to see a change of circumstance, which would be the discontinuation of your employer plan on 12/31, should also allow you to enroll during the closed enrollment period. So
their coverage is historically been less expensive. We stayed with this as a stewardship issue for the church. Thank you.
Yeah, Alicia, the only consideration you may want to take into account in making a decision, if you want to move directly into your employer's coverage, it would mean that you would start over in terms of all deductibles and out-of-pocket.
Right.
And so you may want to just take that into consideration.
Well, their fiscal year is it starts September 1st, so
sure.
The enrollment period is the 15th through the 31st, so the enrollment, and then the fiscal year starts September 1st, which is when the health care would kick in.
Okay.
So the other piece of that is I found out through them today that none of the plans, I'm in Texas, none of the plans on the exchange in Texas are accepted by the medical center or any of its providers, and it's a pretty major institution. So that was kind of a hard blow for us. That meant that all of our providers we'd have to change. So.
Well, this is Gene Fisher. Are you referring to only the ACA plans?
That's what I was told by one of our insurance, our folks in the financial accounting office at the hospital.
Okay, because I'm wondering about the private carriers, whether or not any of their plans would tie into it. And this may be one of those questions that you ask if you are interested in exploring the Gravy solution to understand what they may have to offer through the private plans.
Okay. Is there an estimated, I heard their mention of a fee for the Gravy service. Is there an estimated cost of what that is to utilize their service?
Yes, there is a subscription fee, and it's $15 per month per employee that participates or participates through them to access both the ACA as well as other private plans. So that would be the cost for the utilization of Gravy. And it is a one-year contract.
Okay. Thank you.
You're welcome.
Again, that's star 1 for questions, and we'll move to our next.
This is Tom Plumley again, and I just wanted to ask if there would be a way for, I haven't looked at my healthcare policy in a while. There would be a way for you to provide each of us a summary of what we have, so that we'll know what to compare it to when we get out in the marketplace.
Tom, that is available online on our website already. Choose the benefits or the services, and then healthcare, and you can get a complete description of the coverages that you have.
Thank you.
Hmm?
And we'll move to our next questioner.
This is Marilyn Holloway, and I'm a retired minister, and my question has to do with the cost of the supplement. Will it be going up in November or in January?
We haven't made that determination yet, Marilyn, but I would anticipate that if it goes up at all, it will be very nominal.
Because I read someplace about a 25% increase, but that wasn't talking about individual fees then, was it?
No, what we were saying was that the active plan, because of the utilization, that we were looking at the potential of a 25% increase for the active plans,
For the
not the Medicare plans.
Okay. And because I've been considering, now, when we pay our supplement, does that include the medical costs too, or are those separate?
It includes the medical.
It includes the medical. Okay. So, and again, I could go online and see what those benefits are if I was going to look at maybe changing that.
That's correct.
Okay. And if I did change it, it would have to be done during the time period in November, December?
You would change it at the end of the year, effective January 1.
Okay. All right.
Okay.
Thank you.
And if you have any questions, feel free to give us a call and we can answer whatever questions you may have.
Okay, thanks.
Mm-hmm.
We'll take our next.
This is Marty Williams again, and as I've listened to a few more things being said about the Grady company, I'm in a position where that ends as an interim. My employment will conclude September 1st, and it's hard to know when I'll be employed again. So I was hearing you say that this is available to churches. So sounds like not two individuals who don't have a connection with ministry at the moment. So then what happens to those of us who may be between churches and calls?
Well, there's a couple things. Are you currently participating in our program?
Yes, I'm currently in the church-wide health plan, if that's your question.
Yes, and you can continue to participate in our program through 12/31.
I understand. I'm a little bit
this year.
About what happens January 1, and time is of the essence.
Yes, here's what happens with Gravy. Gravy not only will help you shop as far as what healthcare plan is appropriate for you, but they will also help you during transitions. They are an advocacy program as well. So if you're in Texas and you're going to take an interim in New Jersey or some other part of the country, through their support, they can help make arrangements to find appropriate health care for you.
That's not my question.
Yes.
My question is, in the time that I am not actively covenanted with a congregation, I am an individual out in the world, so I don't have a church to establish a plan with Grady or whatever it's called and establish a one-year contract that would give me access. What do individuals do who are not in a call when health care ends? short of, I understand I can go to Covered California. I've already commented on about what I've found on that.
Marty, you can actually individually have a relationship with Gravy. It does not require an employer. And so those services are still available to you in terms of having access to the individual marketplaces, the individual plans, the private insurance, as well as the marketplace.
And so an individual then would have to bear the cost and take out a year contract just as a church would?
Correct.
Thank you.
Again, that is star 1 for questions. We'll move to our next. Caller, your line is open. Please check your mute button. We are hearing no response.
Sorry, this is Caroline Hamilton Arnold with Week of Compassion. I'm wondering about churches and other organizations that are going to be doing new hires between now and December, and whether their best plan of action is to not enroll new hires in church-wide health and just go straight into the marketplace, or what course of action is advisable?
Caroline, it will depend on the circumstance of the employer. So if the employer has a group plan that requires them to be in the group plan, they would simply add them to the group between now and the end of the year, just like any other new hire. If they have not yet canceled their plan or don't have an alternative option available within the guidelines of their employee handbook, that's what they would need to do. If they have a more open plan approach, then that employee could choose at that time.
Okay, thank you.
Again, that is star 1 to ask a question. Star 1. We will pause momentarily. Again, that is star 1 for questions. We'll take our next.
Hi, this is Doug Kripe with Mid-America, and I heard you mention that individuals could get on the Gravy for the $15 a year or $50 a month, but I've been browsing on the Gravy website, and it says the Gravy is free to you. You can call us for guidance and support as much as often as you need to. So I'm confused about what the website says about the cost and about what I heard you all say.
Well, normally, Doug, the contract is between the employer and Gravy, and for individuals using it, or the employees are then have access to it free of charge. But there is a fee involved with Gravy that the employer typically bears. Okay.
Again, that is star 1 to ask a question. We'll pause momentarily. Gentlemen, we have no further questions in queue.
Okay, let's give it a moment.
Again, star 1 for questions. We'll take our next.
Do you have any idea of how Gravy comes up with its fee? Is it based on the number of employees, or how is that fee based, and what is the range?
The fee is $15 per employee per month. And I'm not aware that there's any adjustment in that, regardless of size.
Okay, so that would be full-time employees probably, I guess.
That would be full-time employees that you are assisting in having health insurance.
Okay. Thank you.
Again, that's star 1, and we'll go to our next.
Yes, this is Scott Brazell, once again. I was going to ask if you could clarify, okay, with a church that has more than 2 full-time employees, currently they're paying the premium directly to the church-wide healthcare benefit program, and that's providing the coverage. But you said, I believe you said earlier that it's illegal for a church with 2 or more employees to pay directly to, like Blue Cross Blue Shield, a healthcare provider. Is that correct?
Okay, let's be specific here. You are participating in church-wide health care, which is a group in itself. You can provide group coverage. You can also provide group coverage through a local vendor. If, however, each of your employees goes out and purchases individual coverage, and you've got two or three people who are buying individual coverage, you cannot reimburse them for that coverage or pay it directly. It's the difference between participating in a group versus individual coverage.
Okay. Now, so in an example where it's just one full-time employee, then that kind of takes care of that problem, because if the church could, in effect, or the employer could, in effect, pay that premium directly to the healthcare provider in that situation.
Yeah, in effect, it becomes a group of one.
A group of one. Okay. Thank you.
Mm-hmm.
Again, that is *1 to ask a question, *1. That's *1 to ask a question. We'll take our next.
Okay, I guess I'm just a little confused. I'm sorry, this is Rachel Moore. Ministers have to be in a group insurance, is that correct?
Ministers do not have to be in a group insurance. Minister can be in private insurance if they choose.
Okay. And in that way, it's taxed, right?
The insurance that you purchase as a minister would be individual coverage that would become a tax deductible expense, medical expense. If the employer pays part or all of that premium to you as additional income, that is taxable income.
Okay. All right. Thank you.
Again, *1 to ask a question. We'll take our next.
Well, this is Doug Kripe again. I was wondering about the health savings account that's been offered through the pension fund, where part of the income, the salary, is set aside and sent to the pension fund that's then used for health care expenses. Will that be eliminated, or does that become another option available through negotiation with Gravy?
Well, let's make a distinction between an FSA program, which you can participate in through, or an HSA, which is with a high deductible insurance product. If you go through Gravy and you buy a high deductible insurance product, you can continue to have an HSA. If you are currently participating in an FSA through church-wide health care, that will be discontinued.
Okay, I didn't distinguish between those two before, but I think that answers the question. So the HSA will be available if it's a high deductible plan.
That's correct.
And Gravy would negotiate with that as well.
They will have that as part of the plans that they have available to you to purchase. Right.
Okay. All right. Thank you.
Mm-hmm.
*1 to ask a question, *1. We do not have any questions in queue at this time.
Let's give it 30 seconds.
Again, that is *1 to place yourself in queue, *1. There are no questions in queue at this time.
Okay. Then I have a final comment, operator. I want to thank everyone for being on the call today. I trust we have responded in a manner that is helpful. Know that if you have additional questions, we would encourage you to email them to us at pfcc1@pensionfund.org. We know that this transition is a very complex and very challenging process. We will continue to work with you, provide more information, and resource you as you move forward. And so if you have further questions, again, email us. Our staff and directors are here to be helpful to you. We want to continue to focus our energy towards assisting in this transition. We thank you for the privilege of serving you and for your interest today. Feel free to get on the call this evening or to join the webinar later this week or as we have other programs along the way. Until then, please call or email us with questions. It's our great honor to serve you. Good day.
That concludes our conference for today. Thank you for your participation and for using AT&T Teleconference Service. You may now disconnect.